Good afternoon. I'm Linda Baker, the Learning Director for the Center for Research and Education on Violence Against Women and Children. On behalf of the Knowledge Hub team, welcome to our research briefing, Soul Expression, Trauma-Informed Dance Intervention. Our presenters will speak for about 15 minutes. Please enter comments or questions for the presenters into slido.com and use the code 7423. And that code will be shown on the slides for your reference. During the last 5 minutes of our research briefing, I will present some of your questions to our guests for their response. The link to the presentation slides was emailed to you earlier this morning. Now I'm pleased to introduce our speakers. Lindsay Jolly is the Director of Operations at Boost Child and Youth Advocacy Center, a multi-service agency that works to prevent child abuse through awareness and education and responds to child abuse cases with a holistic, child-centered approach. Shannon Brown is the research coordinator of the Soul Expression Project and has spent many years as a frontline practitioner working with young people who have experienced trauma and abuse. And now I'm going to turn it over to our presenters.
Thank you very much, Linda. As Linda shared, our project is called Soul Expression, a Trauma-Informed Dance Intervention. So Soul Expression is a partnership between Ryerson University, Boost Child and Youth Advocacy Center, and Unity Charity, which is a national nonprofit organization here in Toronto that uses hip hop to help young people build resilience and continue in their well-being. We are funded by the Public Health Agency of Canada. Today, we're going to be giving you a short introduction about what Soul Expression is. We are going to share a bit about our curriculum, and then I'm going to share some preliminary research findings from the last 5 years of our project. And then we'll have a little bit of a discussion, and as Linda shared, we'll have time for questions. So I'm going to give it to Lindsay now to start the presentation.
Thank you, Shannon. Hi, everybody. Before Shannon discusses the research findings, I'll provide some context with a brief overview of the Soul Expression program. As mentioned, it is a trauma-informed dance intervention that was designed for youth who have experienced child abuse or who have witnessed family violence. In many regions, there is a significant lack of trauma services available for children and youth in Toronto. And so the original intention of the Soul Expression project was to create a program that could be offered to youth who were on waitlists for trauma services. Over the 5-year implementation of the project, the criteria was adjusted, though, to include youth who were already engaged in therapeutic services. So in planning for this project, a dance intervention was decided on with the understanding that trauma is held in the body, but that the body is often forgotten when treating trauma. It was also chosen because dance can be used as an alternative form of expression when words or talk therapy are not enough. And dance can be used to address some core capacities impacted by trauma, such as healthy connections with others, sense of empowerment, self-awareness, self-expression, and self-regulation. So the Soul Expression is a 10-week group that is facilitated by 2 dance instructors and 1 trauma therapist. The curriculum was co-developed by senior clinicians at Boost CYAC and senior dance instructors from Unity. The curriculum itself is divided into 3 parts. Part 1 includes weeks 1 to 3, and this section is designed for participants to connect with their own body, to create a sense of trust in their capacity to move and to engage through their body. Part 2 includes weeks 4 to 6, and this is when participants are gently encouraged to begin to interact with each other more. This connecting and listening and acknowledging of each other is facilitated through movement activities. Part 3 is weeks 7 to 10, and this is designed to build on community relationships and to establish a sense of self within a community. And so throughout the curriculum, each session has its own learning objectives and related activities, but there are some common elements that you will see that the participants experience across all of the sessions. And these common elements include grounding and body awareness, opening and closing activities, a structured warm-up, and as well as journaling. And for the dance instructors and trauma therapists that are facilitating the group, a session debrief is included. So with that brief understanding of the program, I will hand it back to Shannon to discuss the research findings.
Thanks, Lindsay. So we set out with the following 3 research questions. The first one asks, does trauma-informed dance intervention reduce trauma symptoms among young people who've experienced or have been exposed to abuse or violence and are not currently participating in trauma therapy? Our second question is, how and why was a trauma-informed dance intervention effective or not in reducing trauma symptoms? And then partway through the project, around year 3, we added in the third question, which asks, how does this dance intervention, how is it designed and implemented in a way that's trauma-informed? And this came from many really rich conversations at a Project Leads working group, where we were considering different ways to promote the project. And we were met with some challenges in terms of where we should locate the project and who should be invited to the project. And so we really wanted to use this opportunity to use the conversations that we were having in considering a trauma-informed intervention and what makes it a trauma-informed intervention. So we are still currently analyzing the qualitative findings, but just to share that we did pre and post measures, and those both included the trauma symptoms checklist for children and the multidimensional anxiety scale for children. So all participants did it on the first group and then within 2 weeks of the last group. The mean age of our participants is 13.6 years old. The number of different types of abuse or violence experienced is 13, and that's quite a considerable number considering the mean age of the participants. 19.4% were participating on a wait list for therapy, and 62.9% had received therapy because of their experience of abuse or violence. What I will share today, though, is a little bit more about our qualitative findings. We conducted semi-structured interviews, post-intervention, and focus groups with facilitators and dance instructors, and those were separate. The interviews were recorded, transcribed, and then analyzed by the research staff. So we are nearing the end of our analysis of the qualitative findings, but I can share with you some of the major themes today, and those include the theme of safety, sense of community, the impact on the self and individual, and programming elements. And so next, I'm just going to take you through those themes a little bit and just share a little bit about the codes and some quotes. So in terms of safety, this had a lot to do with facilitation and relational safety, as well as choice and collaboration. And I think you'll notice that our themes are very congruent with how to provide trauma-informed services. And so one of the examples that we chose to pull out is from a facilitator during one of their focus groups. And they said, I definitely feel like the program was a safe space. There were moments where the youth shared that they didn't feel safe being themselves at home or in school. But this was a place where they could acknowledge and just honor how they choose to identify and move and carve through the space and everything. So our second theme has to do with a sense of community. This one is both in building relationships amongst each other, but as well as building connections within the hip hop community. Our participants are offered to participate in other Unity programs post-group, and many of them take that opportunity because they have found something within the group that allows them to understand themselves or other people in a different way. And so one participant mentioned here, I don't feel as different. I feel like everyone was equal. And that's quite a considerable theme throughout all of the interviews. Many young people begin trauma therapy or particularly begin our group and they feel alone. They feel like they're the only ones that have ever experienced this. And so while the goal of the group is not to come in to talk about your experiences, they often come out through the active movement and in those building of relationships with each other and with the facilitators. So the third theme that we identified was the impact of self and the individual. And these include, the anticipation of soul expression. So being nervous upon entering the group, and then post-group feeling like they had found something that they didn't know that they were missing. A reduction in their stress, in their stress symptoms, and a sense of mastery. So enjoying the dance and learning something new, a new way to move their body, or a new connection to the community. So the quote that highlights this, we felt, was a young person who shared, "I interpreted my dance into how I was feeling, but a different way than communicating, and having grounding sessions with a trauma therapist and stuff that really helped me too. It would give me more coping techniques and quick ways to express myself." And then the last theme had to do with program elements. I think many of us on the call today know that food is very enticing to young people. And so they did have a very positive impact. We did a snack before the group, and then everyone shared a meal after a group. And many comments about the facilitators, both the dance instructors and the trauma therapist. And the quote here is, "They're so nice when they come and they greet you, and they're really nice instructors, how they act and how they teach, and everybody liked them." So now I'm just going to have a very quick discussion, and I'm bringing you back to our original research questions. So does a trauma-informed dance intervention reduce trauma symptoms? So the qualitative findings suggest that soul expression reduced trauma symptoms for many participants, particularly in terms of reducing feelings of stress and depression, helping with nightmares, helping them be more energized and happy, regulating their mood, and reducing feelings of self-harm. But of course, we do have to keep in mind that these are not generalizable, but the findings are helping us understand the potential impact and how a program like this might be effective. In relation to the second question, how and why is it effective or not at reducing trauma symptoms? So in terms of the how, this is multifaceted, but a big piece of it is that it's developed an embodied way for them to express themselves through dance. Also, relational safety is very important, which is fostered through the building of relationships and community within soul expression, and the feeling of a shared experience in terms of dance and violence, which allow them to recognize that they are not alone. I think that this is extremely important because when experiences of violence or abuse specifically, they think that it's only happened to them, as I shared earlier. The program is important in building a sense of community and helping them build confidence with themselves, and also provide stress management techniques that have helped with trauma-related symptoms. The third question, we're still analyzing. But I think what we can say right now is that when we explore the components of a trauma-informed research program or our trauma-informed research program, I think we need to really consider that from intake to discharge, and consider questions such as what is safe and the neutral space, and who are safe and neutral people. I have an example where we were going to partner with a school in our community, and we had very rich discussions about how schools are not always safe places for young people, nor are the people employed by schools very safe places. But also, in addition, schools are not easily accessible to people from other communities, both in terms of travel and distance, but also in terms of community and relationships. So beyond soul expression, it's important that we consider how we connect youth to services and resources outside of our community. And that's something that by design was built into the program, and really important to consider when we're running a time-based program. So I am done my piece of the presentation, and happy for Linda to take it back.
Thank you, Shannon, and thank you, Lindsay. And I want to ask you a few questions in our remaining minutes. The first question is, while it started out as a program for youth who were on a waiting list, who had experienced trauma and trauma likely through violence experiences, I'm curious if there's any plans or if you have any sense of what was the difference for young people who continued on a waiting list versus young people who were in soul expression as well as in an intervention program?
So while we're not able to, I don't have those findings right now. What we found partway through the program was that many young people who have experienced or been exposed to abuse or violence aren't necessarily the only ones, are not necessarily on wait lists. So there's many more young people that we can bring into the program just through community relationships. So we each had a part of recruitment. So, whether it be through word of mouth or whether it was Unity that was going out to do a presentation in the community. So I don't have the data in terms of how it impacted one group over another. But what I can say is that through a trauma-informed perspective, only accessing young people who were on a wait list for traditional therapy missed the mark a little bit in terms of who else might benefit from this intervention.
Yeah, I really appreciate that, and such an important takeaway from this intervention. I also was curious about, Lindsay, were you going to add something to that? Sorry.
I just think it's an important piece to recognize that because it's not talk therapy, because it's not typically a traditional form of therapy, it also creates an opportunity for youth to engage in a support service, of some supportive programming, perhaps before they think they're ready for therapy. And so I think it's just a key piece that it creates, it increases accessibility to services and programming for youth by offering something that is not a traditional form of therapy. And to sort of support Shannon's statement that by opening it up to youth who were not already on therapy lists, it allows those individuals who wouldn't have been on those lists because they weren't ready for that therapy in the first place to access the programming.
So in some ways, Lindsay, it's almost as if it's a bridging. It helps with the bridging between where they're at now and when they can get into, or if they're going to get into. So that's a really important piece. Thank you for that. I'm curious, when we think of hip hop, especially someone in my situation looking in at it, I'm curious, not all youth, some youth are really drawn to it and may have even had experience in the hip hop community. Others would not. Did you find a difference? Was it largely youth who accepted this opportunity, who were involved in the community or the dance to some extent?
Yeah, I can say, from my understanding, many of the young people had never been exposed to hip hop or art-related hip hop opportunities, but they did, they did understand that part of their expectation was that there was going to be movement within the group. I want to reiterate, though, this isn't necessarily, it wasn't a hip hop dance class where you go in and you learn moves and you choreograph a routine. What we did was use the elements of hip hop and art-related elements to promote movement and collaboration and cohesiveness and community. And so, one of the best examples I can give, and I've shared this story many times, is we had a young person, and this came out in our facilitator focus group. We had a young person who had come to group one day and wasn't really feeling it, didn't really want to participate. And one of the initial exercises was just to use your body and put it into a pose that represented how you were feeling that day. And so this young person removed themselves from the group and went and stood at the back of the room. They just weren't having it. And so the facilitators were able to pick up on this, and they decided to move the entire group to the back of the room against the wall with that young person and asked everybody to make a pose against the wall. And it's just this beautiful visualization of a young person excluding themselves from the group and the facilitators bringing them back in, and they don't have to do anything. So it was a moment of connection. And that's really, the themes of the study, that's really what it comes down to. You didn't need any experience, doing hip hop. There's also elements of spoken word and graffiti built into the curriculum. And you could choose to pass, or you could choose to, take the whole opportunity to, develop your skills. But it wasn't necessarily, it's not a choreographed movement. It's built into the curriculum. The other thing I want to just very briefly mention, and I don't think I mentioned this before, is that part of us designing this study was to provide trauma-informed training to everybody involved. So every researcher, every therapist, and every dance instructor as well as there many other people at Unity who might not be instructing the groups. They were all given trauma training so that they could understand these elements a little bit deeper while they were facilitating.
So important. I really appreciate that clarification and that sense of connection, which we know is so important in terms of trauma-informed interventions. I am afraid we are out of time, but I want to thank you, Lindsay. Thank you, Shannon, for sharing about this really exciting program. And we'll be interested in the future to learn more about what the future plans are and if it's going to continue, because it's certainly very exciting. So thank you to both of you.
Thank you, Linda.